In weight bearing, we noticed that there was a loss of dorsiflexion, so we would like to do a test called the Talar Swing Test to look to see if the talus glides when they're going into dorsiflexion. Clearly in weight bearing we saw that there wasn't a good glide, so what we do is we do a 4-point hold on the talus. So we have the neck of the talus here, and we bring our thumbs on either side, and then our index fingers go behind on the talus. We want to feel with dorsiflexion an external rotation of the talus. We try to keep the bottom of the foot parallel to the floor if we can. And for him, he's just really restricted. And you look to see if you can feel the glide. For him, when we come, there's a tension that, and I do have a bit of a glide, but his Achilles is pretty tight too, either increased tone. So it's a glide's present, but if there's a glide and a lack of dorsiflexion, then we might think it's a muscular component. Some people, when you're doing it, you don't feel the external rotation and it's a block. Some neuromuscular reeducation after you do a manipulation, or to see if you can get further into the barrier, is just to have the patient dorsiflex. Good, and relax. And then you look to see if you can get more of that glide. Go ahead and dorsiflex, and relax. You're trying to keep that foot parallel to the floor and see if you can gain dorsiflexion that way. It's nice because you have your hands underneath, so you're simulating a little bit of weight bearing too. If we decide we're going to manipulate this joint, we'll follow up with that neuromuscular reeducation, and then we'll show you a mobilization with movement for push-off in weight bearing, which has really good results because the body can integrate that into the functional push-off that we were discussing earlier. So that's the Talar swing.